Recording in progress.
Okay, everyone, we were with you a couple of weeks ago, just before the holidays, and at that point, Dr. LeBaire suggested the Omicron variant would be coming and would be impactful, and that has come to pass. So we wanted to get back together with you today, and we will probably be on a weekly cadence now for at least the next few weeks, so you can plan accordingly. Just to go over the ground rules again, Dr. LeBaire will start with some comments, and then we will open it up to questions. If you could just identify who you are with when you enter. It's open season, so just jump in if you have a question. We will be more than happy to take it. As I mentioned, if you want the ability to record, let me know. We do provide it afterwards. Just reach out to me or to Sandy Leander. And with that, I will turn it over to the Executive Director of ASU's Biodesign Institute, Dr. Joshua LeBaire.
Well, good morning and Happy New Year to all of you. I wish it were slightly different circumstances than we're in, but nonetheless, hopefully you're all healthy and well. So as Jay mentioned earlier, we did talk a few weeks ago or a couple weeks ago about concerns that Omicron was coming to Arizona, or at that time it was already here. And certainly that has continued to evolve. We are now in a clearly well-defined surge now. I'm going to just share some data as we usually do here, just so that people can sort of see the magnitude of it. So I'm going to pull up my screen here. For those of you who may be new at looking at this graph here, this is a curve that shows kind of the rate of growth of the virus in the community. And here's where we are right now. If you can see where the hand is pointing, this is the rise in Arizona. And a couple things to note here. First of all, the steepness of it going up and to the right, that's a sign of how rapidly rising the case number is in the state. If you look over the entire course of this pandemic, which is shown on this graph, we have nothing that matches that rate of rise. So this is the fastest rate of rise we've seen, even punctuated by the fact that you can discretely see day to day by the dots here. When the dots are kind of mashed together as they are in some parts of this graph, that's a sign of, growing but slow growing. But when they're separated like this, that means it's growing up very quickly. So things are going up very quickly, and not surprisingly, we think this is due to the Omicron. I mentioned to you last time that we were going to be plotting Omicron on our website, and here it is. This is the S gene dropout per 100 tests. And this is sort of a real-time measure of Omicron in Arizona. The sequencing data are also very important. Dr. Lim here at ASU has been doing a lot of that, and he's confirmed that all of these S gene dropouts so far have turned out to be Omicron. But the sequencing takes about a week and a half to get done, whereas this is essentially a daily measure. And you can see that we've been in the 80% range for over a week now with Omicron, and most latest are put us over 90%. So there are some lingering Delta cases around Arizona, but what's circulating right now in our caseload is overwhelmingly the Omicron variant. If you look at hospitalizations and ICU beds, you'll see that hospitalizations are starting to uptick a little bit. Right now, the ICU beds are not upticking yet, although that's not a surprise. That's likely to happen later. Typically, that's a lagging indicator, as would be the rise in death counts. Those would both be lagging indicators, something that we would not see right away. So, obviously, there's been a lot of story about how Omicron may produce a milder disease. And there does appear to be some substantiation to that in terms of the reports we're hearing. But I think we have to be very cautious on how we interpret that. on an individual basis, particularly for people who are vaccinated, that may well be true. But I think that it's counterbalanced by the fact that there is a huge number of new cases expected that will arise from this Omicron variant. And even though a small decrease in the virulence, it will be largely offset by the large caseload that we're likely to see here. I'm basing this to some extent on what's being seen right now in Europe. If you take a look over the pond and look at what's happening, particularly in the United Kingdom, for example, they have seen a dramatic rise in cases. In fact, maybe I'll just show you very quickly some of those data. Yeah, so let me see if I can pull up. Yeah, so here, for example, this is the rise in caseload in the UK, keeping in mind that in the United Kingdom, over 90% of people have been vaccinated and over 60% of people in the UK have had a booster. So that this is their vaccination rate in the UK right here. And then what I want to point out to you, and that's important to note, is the rapid rise in hospitalizations that they've observed there. So despite the fact that they are more vaccinated than we are here in Arizona, and the fact that they've got more booster shots than we do here in Arizona, they are still nonetheless seeing a rapid rise in hospitalization there. And I think that's likely something that could happen here, and we have to pay attention to. Right now in the UK, roughly 1 in 5 people has COVID-19. That's a staggering number. I mean, it's, between 1 in 5 and 1 in 6 people is reporting positive. That's a huge fraction of the population, and something that we need to pay attention to, especially given that our vaccination rate is not as good as theirs. So those are things to pay attention to. It is certainly true, and it's an important reminder here that having been vaccinated will certainly protect you to the extent of significantly reducing likelihood of hospitalization and death, even from Omicron. We think that it's at least a 15-fold benefit in terms of severe disease to be vaccinated. But in terms of protecting against an infection, the primary vaccine series is not particularly protective against an infection. Lots of breakthrough cases for Omicron if all you've had is the first 2 doses. If you get a third dose, if you get a booster dose, then the protection goes from roughly 25% to over 75%. So a huge bump in protection from a booster vaccine. And this is just a plea for, it's much better to prevent this disease than it is to try to treat it. There are some treatments emerging. The most recent drugs that have been discussed are not yet approved, and so they are not yet available. Remember that monoclonal antibodies do not work particularly well for Omicron. Because of the mutations in Omicron, the monoclonal antibodies are not likely to work well for it. So the treatment options are not as good as they were for Omicron as they were for Delta, and far better off to prevent this disease than to try to wait till you get it and then hope that you can treat it. Probably a big emphasis now going forward is going to be on testing. And I think as many of all of you have heard, home tests are hard to get these days. A lot of places are sold out. Make a pitch for the fact that ASU continues to offer its free public testing in partnership with the state of Arizona through its saliva testing. We still do that. It's currently available at our SkySong site here on, I guess it's Scottsdale Road now, or Rural Road, whatever that is. And so that's available. Our result, that's a PCR test, so it's the most accurate test available. And the results are typically available within 24 hours. So people get their answers pretty quickly from that. But, managing day-to-day life with testing is going to be increasingly important because we're just beginning to see the rise in the state of Arizona compared to the rest of the country. The East Coast is getting, as you know, hit pretty hard now by COVID-19. So I think that's likely to happen as well. So I think that those are most of the comments that I have. Probably there will be questions, so I'll stop here and let's go to the questions.
So just to point out to everyone in the chat, Sandy Leander put the link to the COVID testing sites. SkySong is at McDowell and Scottsdale Road, roughly. And so with that, move on to questions. Jared?
First of all, thank you for taking the time to speak with us today. You brought up, the at-home testing and we're seeing the lack of availability of them. A lot of people are buying them up. And you also brought up the fact that, we're seeing this kind of surge we're seeing in the number of cases being reported. But that brings me to something I wanted to ask you about, which is that, with those two things kind of going at the same time, the lack of at-home tests and this surge, do we have a real good idea then of the true number of COVID cases out there? I mean, is everyone really reporting their at-home tests if they're coming positive?
Right. No, your point's very well taken. The numbers we're seeing are probably an underestimate of what's out there, just because, as you say, a lot of those, I would say most of those at-home tests are not reported, so they don't end up in the statistics that we see. And so consequently, I don't think we have a great idea of how many cases are out there, but we know it's rising rapidly. And sort of judging by what's been seen elsewhere, it's likely to rise extremely rapidly. So, keep in mind that this virus is highly, highly transmissible. The Omicron virus is. I would make the assumption that if somebody was on the elevator before you and left, and they had COVID-19, it's still floating around in the air in there, and you're going to go in and possibly get it. So, it's everywhere in the air. So all the things that we've learned over this, pandemic that we do when the virus is prevalent in our area, we should be doing those. So, wearing masks when indoors, especially around other people, would be something I would do, especially if you haven't had a booster shot, because if you haven't had a booster shot, the primary vaccine series doesn't necessarily protect you against getting infected, at least.
Stephanie.
Hi, yes, thank you for holding this. It's Stephanie Innes from the Arizona Republic. You mentioned masks, and I'm starting to hear that cloth masks aren't going to be as protective against Omicron. What are your recommendations for masking?
Right. First of all, any mask is better than no mask. So, use what you got. I think that if you're really concerned, the N95 or the K95 masks are probably the most protective. My own experience with those is that I can't wear them for a very long time. It just gets too hot for me and hard. And so I typically will wear a surgical mask, which I think is a good compromise, largely because it's specifically designed to filter out things. It has the wire that allows you to kind of contour it to your nose. And if you put it on tightly, it should do a pretty good job. So I can wear that for much longer periods of time. But yeah, the most important thing is just to be wearing one when you're around other people indoors.
So a cloth mask is better than nothing.
It's certainly better than nothing. Absolutely.
Thank you.
Christine Stanwood, let us know who you're with.
Hi there, this is Christine Stanwood with ABC 15 Arizona. Quick question, with the rate of transmission being so high with this variant, is it your impression that we may be inching closer to herd immunity, or is that even on the table with this variant?
Yeah, I don't know. The whole concept of herd immunity is getting a little fuzzy at this point with a variant that is so capable of infecting people who've been either previously infected or who have been vaccinated. So, this variant is just so transmissible, even to people who've had a primary vaccine series, that I think certainly in Arizona, where I think we probably have maybe a 30% booster rate is the best number I've seen. That means that a lot of people here are susceptible to at least getting infected. Now, we're closer to 65, 66% vaccinated, fully vaccinated. And that suggests that severity of disease is not that high among that population. But still, that leaves plenty of people who have not been vaccinated yet, and so we're not quite there yet.
And then when do you anticipate to see a drop in cases? Is this just a surge from after Christmas holiday, New Year's Eve holiday, or is this a factor of something else?
That's a tough one. A lot of people are throwing around the notion that at the end of February, we might see some relief based on the data from South Africa. I'm a little concerned about extrapolating from South Africa only because that population is very different from ours. Much younger population than ours on average, and also a population that, most of them had their exposure via infection, not necessarily via vaccination. So it's not, I think I would be looking, I think a better model for the US would be Europe and the UK. And right now they're too early in their peak for us to be able to draw any conclusions about what it's going to look like.
Thank you.
Bud Foster.
Yeah, this may sound like a simple question, but something that I'd like to talk about.
Bud, who are you with? Let us know who you're with, please.
Did we lose him?
Can you hear me?
Yeah,
now we can hear you.
Okay.
Yeah.
This may sound like a very simple question, but I would like to know, what's the value? Can you explain the value of testing and why everybody out there who has any suspicion that they might be infected should test? I just want to know the overall importance of testing.
Great. Bud, where are you from?
A KOLD in Tucson.
Gotcha. Okay. Yeah. So, I mean, I think the importance of testing is that this particular variant, it creates an infection even earlier than some of the other variants have done. It looks like people can be spreading virus as early as 2 days after exposure in this case, and certainly well before they have symptoms. And so the value of testing is if you think you may have been exposed or if you're concerned, testing can alert you to the presence of the virus before even the symptoms would tell you that you have it. And then of course, we know we're in flu season and we know that we're seeing a flu season this year. And so now you may have symptoms and you may not know, are the symptoms due to a cold? Are they due to COVID-19? Are they due to the flu? Because the symptoms of COVID-19 are relatively nonspecific for a respiratory illness, testing both tells you what you have or helps you know whether you have COVID-19 or not. And it also alerts you to the fact that you may have the virus when you didn't think you did. So I think, testing is one of our key tools in monitoring who has it and where they have it. If you document that you have it by testing, then you can let people know that you may have been in touch with, that they should be getting tested as well. They may have been exposed, and this would help us limit the spread. And let me just add here, in many ways, that one of my biggest concerns right now, and this came up in our last conference, is that the hospital system in Arizona was already heavily stressed by the Delta variant. A lot of the cases that are in the hospital right now are leftovers from the Delta wave. And if a lot of new cases crop up due to Omicron, and if even a fraction of those end up in the hospital, I'm concerned about what's going to happen in the hospitals right now. And so kind of one of the things we should be paying attention to is, back in the day, we talked about flattening the curve here. If we can just keep the spread of this thing a little bit more under control so that we don't overwhelm our hospitals with people who suddenly need to be, on ventilators, who need oxygen, who need all this care, when we've already got a stressed medical system, that would be a laudable goal and something that I hope we pay attention to.
Brittni, you had a question?
Hi, yes. What concerns, Dr. LaBaer, do you have as college students return to campus?
Yeah, well, obviously, in any circumstance where you bring people together, there's always concern about spread. Obviously, here, ASU has historically been very good at managing and keeping the rates of infection very low. I start teaching myself next Tuesday. And so I can promise you all of us in the room will be wearing masks. I personally prefer to teach in person. I really think it makes a big difference to students' education to have them in the same room and have that interaction. But obviously, we're going to be doing everything we can here at the university to protect people from getting infected and to prevent the spread through testing, through mask wearing indoors, through all the things we know work at preventing spread of the illness.
I know that some colleges have gone completely online. Do you know if that's something at all that ASU is talking about as we see a surge?
ASU is always open to all possibilities. I know President Crow is always looking at all the alternatives. At the moment, I think our plan is still to be in person as of next week. But obviously, we're prepared to make adjustments as conditions change.
Thank you.
Welcome. Joanna Allhands.
Hi, Dr. LeBaer. It's Joanna Allhands from the Arizona Republic. I'm wondering if there is worth in sort of making a distinction between PCR and antigen tests. And the reason I'm asking that is because I know that antigen tests can sort of have this false negative for some people. And so if you've got people who are not necessarily symptomatic, is it worth making that distinction for people? Like if you have symptoms, maybe if you do a home test or something like that, that might make sense. But maybe if you're just wondering if you're sick or you're just doing this for surveillance or that sort of thing, and you don't necessarily have symptoms, is it worth making the distinction that, you should really get a PCR?
Yeah, well, it's a good point. One that I probably should have brought up myself. So, so just to remind everyone, the antigen test measures the presence of proteins produced by the virus in people who are infected with the virus. And it can be done. The advantage of an antigen test is that the answer is very fast. So you can take the test and know within an hour and a half or less whether or not you're positive. Whereas a PCR test measures presence of the genetic material in the RNA of the virus itself. Without a doubt, the PCR test is the most accurate test we have. It is also the most sensitive test we have. The saliva test that ASU does is a PCR test. It is highly, highly accurate. The PCR tests do take longer to get the answer back. Typically, it's an overnight kind of response. You don't get it like immediately. But it's a definitive answer. It's the most accurate answer you'll get. So if you really need to know, that's the best way to do it. There are advantages. The chief advantage to the antigen test is just hopefully its availability, although right now they're not particularly available. But, I'd rather do an antigen test than nothing. But if I had my choice, and I do, I always go for the PCR test because it's the more accurate test and it's the most sensitive test. So even when an antigen test will be wrong, as you say, the false negative result, we know of many cases of people who tested negative by antigen test who then tested positive by PCR, which is a more sensitive measurement.
If I could just ask a follow-up on that, do you have any studies that you can point to on that of just sort of the prevalence of false negatives or just
the best study that I know of that was from Tucson, from our colleagues at the University of Arizona did a whole study on false negatives from the antigen tests. And I don't remember the actual citation for that, but they actually published that and found that particularly in people who are asymptomatic, the antigen tests missed something like 70% of positives. So there's a high false negative rate there.
So, and one more just real quick question. I know ASU was working on having possibly some sort of prototype of PCR test that could be more rapid. Do you know sort of where that stands?
They have a prototype built, and they're looking to get what's called an IRB, an internal review board, clearance to start clinical testing. So they want to actually start testing that device. So that's coming on. Jennifer Blaine Kristen is kind of spearheading a lot of that work, and it looks promising.
Ariana Taylor. 12
Hi, Ariana from 12 News. I just had a follow-up question to a point you made earlier. You said there were a lot of breakthrough cases for Omicron, and that if people did get the booster shot, then their protection will go from, I think you said, was it 25%? I just needed a clarification on those figures.
Yeah. So, this is based on a study that is not yet peer-reviewed, so I have to a little bit of caution there. But the data that they have looked at suggests that against Omicron, the primary vaccine series has about a 25% protection. But if you get a booster, it goes up to over 75%. And I will just comment briefly that, and this is now personal commentary now, I personally think that what's going to evolve is that booster shot is going to become part of the primary vaccine series, that it won't be thought of as a booster, but rather it'll be thought as the third dose in your initial vaccination. And I base that on the fact that several recent vaccine schedules have all included sort of a 6-month dose. That's true for the HPV vaccine. It's true for the shingles vaccine. A lot of the more recent studies suggest that biologically, our immune systems do better if they get kind of reminded of the antigens for the pathogen at around a 6-month time point. So I suspect that over time, it'll be a three-dose regimen, and that 6-month dose will be important.
So Stephanie and Brittni, I'll come to you. We did have a question in the chat that came from Barbara Villa. Her mic isn't working, and let me get it and read it to you, Josh. Fatigue is a common symptom with Omicron. Can that be contagious considering it's not airborne in nature?
I'm not sure I fully understand that question, unfortunately. So, fatigue is...
Barbara, if you want to send me a clarification.
Fatigue is a symptom for sure. But Omicron, without a doubt, is highly infectious. And if you have fatigue as a result of the virus, there's a very good chance that you're producing virus. Now, if the fatigue keeps you at home and away from other people, then you're not going to spread it because you're at home. But if you're out and about, then you're probably spreading it.
Barbara, let us know if that covered it. And if not, we'll circle back. Stephanie.
Yes. Hi, Stephanie from the Arizona Republic. So just 2 follow-up questions. One, are you saying, Dr. Libera, that you think Omicron is dominant in Arizona right now?
Overwhelmingly, yes. I think
Okay.
Our data at ASU suggests that it's over 90% of what we see right now.
Okay.
And I suspect that that's true everywhere. We just happen to get the answer faster, partly because the test we run immediately alerts us to the likelihood of an Omicron case. And then Dr. Lim is in the same building, and literally his benches are right next to the clinical lab, and he sequences them right immediately. So I think it's more than 90% of what we're seeing is Omicron now.
And then just the second part of the question is, why does Arizona always seem to get these waves later than like New York City? I don't really understand that.
The modelers in the university and I go back and forth on this a lot. And I've had this conversation with numerous colleagues in the field, and I don't fully understand it. But you're absolutely right. It does seem like it starts on the East Coast and then it comes here later. And Arizona seems to be at the end of the whip, as it were, kind of the tail of the whip. We get the last shot for some reason. And I don't know if it has to do with weather. I don't know if coronavirus is going to turn out to be seasonal and kind of peak in January, much like the flu does, or why. But you're right. It does that, and I don't have a good explanation for it.
Okay, thank you.
Brittni.
Hi, Dr. Libera, when students test positive for COVID or staff members, would you recommend they quarantine for 10 days or follow the CDC's new 5-day guideline with a 5-day mask up?
Yeah, I believe in the 5-day guideline from the CDC. I think that the CDC has really looked at the data, and what they're looking at is the likelihood of spreading virus after that 5-day window goes down. Now, be very specific here. The 5-day recommendation is that you can return to work, but you should be wearing a mask for a full 10 days. And I think that's critical. So the mask wearing is a big part of that. It's not just, you're done. But nonetheless, the data suggests that after that window, there's much less virus coming out of the person at that point. So I think I buy into the CDC data.
Okay, thank you.
So Josh, Barbara Villa back clarifying, is there any way a person infected with Omicron can spread it when all they're experiencing is fatigue?
Yes.
My
yes.
question is based on several sources I've read that cites fatigue in infected people.
Yes. Even if your only symptom is fatigue, if you have the virus, you are likely to spread it. Absolutely. Anyone infected with that virus, even if you're asymptomatic, you are likely to spread it. And so, this virus grows up to very, very high numbers. What the term that people in the field use is the viral burden, which means the amount of virions in your body is very, very high. And so if you have any symptoms at all, or even if you have no symptoms, if you've been infected with this virus and you're in that 5-day window, you're likely to be very infectious.
Christine.
Sorry, one last question. For those who test positive for the Omicron variant who have not been boosted, would you recommend getting a booster, even though some may say that they have natural immunity after getting the virus?
Right. So this gets into a complex scenario. In fact, we were talking about this a little bit earlier today. It gets more complicated to figure out what to do in individual cases. For example, we do know that people who have had, that if you have had the virus, you do generate some immunity, but the level of immunity that you generate from a natural infection varies a lot from person to person. And it is not very predictable. And it depends in part on the person, and it depends in part on how severe their infection was. People who had severe infections tend to generate more immunity than people who had mild infections. So if you had a quick bout of it and it was just a few days and mild symptoms, I would not count on having a lot of immunity from the natural infection itself. That said, people who've had natural infections and who've been vaccinated look to be what we call super immune. They turn to have very strong immunity. The combination of a natural infection plus vaccination seems to provide more protection. And that seems to be in both orders. So if you had the infection first and then got vaccinated, that's really good. But if you got vaccinated first and then got infected, that also looks to be pretty good. So now you're raising the question, well, if you've had a vaccine series and you've had a breakthrough case, do you need a booster shot? We don't really have data on that. And it's not clear that it would be advantageous. Would it hurt you to get a booster shot? Very unlikely to hurt you to get a booster shot. So there would be no disadvantage to that, but it's not clear that it would add much value if you both had a primary vaccine series and you've subsequently had the infection. Sorry for the complicated answer.
It's a complicated issue.
It is a complicated issue.
Other questions? Okay. As I mentioned at the top, we will likely be back on a weekly schedule with this, at least for the next several weeks. So thank you for being with us. Again, if you have any follow-up, please feel free to reach out to me or to Sandy Leander. Have a good week, and we will see you soon. Thank you.
Stay safe out there. Take care.
Thank you.